Welcome, welcome to part 2 or speaker number 2 of our Healing Mama Parent Shower Week. Yay, balloons. Parent Shower Week. Yay, balloons. All right, so our next speaker who will be joining us is going to be Sandra. Yes, fantastic. All right, so we are gonna... Yes, and we are, did that work? It worked. She's going to be joining us. Yay, it worked.
Yay.
Technology. Thank you for joining us today and for being a part of our Parent Shower Week. This is my attempt at having balloons.
I love it.
I tried buying helium balloons, and of course the place that I went to was like, we don't have any person to do it, so we got these balloons.
Yes, that's the trouble.
So thank you again for joining us, Sandra, and for taking the time out of your Tuesday. I mean, is it gray where you are? Because it's not so pretty here.
Yeah, it's very gray. We don't even have the sun shining to help lift our spirits today. It's just kind of a gloomy day.
Yes, but we're gonna raise everyone's
Pump it up
right now during our session together. Amazing. All right. So, did I do that right? No, we're gonna do this one. See, this is me attempting to be technologically savvy, right? We're like,
That's okay.
We can do this. I don't want to. There you go. We're there. Okay. So we're ready. Thank you so much, Sandra, again for joining us today and talking all about the magic of breastfeeding and lactation. And congratulations on being certified as, I'm going to let you say the correct certification.
An International Board Certified Lactation Consultant. IBCLC.
Ladies and gentlemen.
Woohoo!
So, Sandra actually has many areas of expertise around prenatal and postpartum care. Not only does she take care of lactation and breastfeeding, but so much more. So I'm gonna let Sandra take the stage and tell us about, first, what it is that got you to work in this field, and then tell us all of the areas of expertise that you graciously take on in your work.
Thank you. Yeah, it's like motherhood. I think you just take on everything because why not, right? So thank you very much for having me. Again, my name is Sandra. I am a registered nurse. I've been a registered nurse for 16 years. And the entire time of those 16 years, I have worked in obstetrics. So I have worked in labor and delivery, antenatal, postpartum, high risk and low risk pregnancies, and then also in private practice. So I still work part-time in the hospital because I absolutely love being and doing what I do at the hospital. And it also keeps me current, which I think is so important, to understand what moms and families are truly going through.
Exactly.
I am also a mom of 2, so I have 2 little ones of my own, although, I can't say little anymore. That's slowly going to outgrow them because they are 6 and 3. They just had their birthdays in the last 2 weeks. We do.
Happy birthday.
Thank you. We do birthday, Christmas, birthday. I didn't want a winter baby and holiday baby, and I got 2. So all good plans get thrown out the window. Yeah. And with both of my babies, being a registered nurse, I had a lot of knowledge behind me, a lot of book and clinical and, bedside nursing behind me, but I didn't actually have true hands-on mom experience. And, you think you're prepared. You totally think you're prepared. I think we all think that we're pretty prepared when we have kids. And a lot of the stuff that we learn is really hands-on experience, right? On the job training, and either it works, it doesn't work, you sink or swim kind of thing. And breastfeeding, I struggled with both of my kids. I had low milk supply that really, who can anticipate until you're in it and you're trying to breastfeed.
Exactly.
My daughter had a tongue and a lip tie, and I didn't want her anywhere near my breast for the first 2 weeks, which impacted my already low milk supply. And she slept beautifully. That was the one great thing, was she was a good sleeper. And then my son, right, yes. My son came around, and again, I struggled with breastfeeding. A little bit different. I had the first experience, so I was working with a lactation consultant, but we still had our struggles. And we ended up breast and bottle feeding. I did that eventually with both of my babes because that's what worked best for us, and my low milk supply. But I knew that, I needed help going into that pregnancy and postpartum, and then my son was not a good sleeper. So, I've really experienced it in terms of breastfeeding and sleeping. I did have good pregnancies, good labor and birth, so thank goodness for that. But I realized that, all moms need somebody in their corner. They need somebody to help them, to support them, right, to ride the waves of motherhood with them and help them. We think that asking for help or seeking help is often a sign of weakness, when in fact it is truly a sign of recognizing our worth and saying, hey, I'm worth it. Like, I need help, and I'm not going to just do this by myself, especially with COVID. It's so important because we don't have our normal, friends and family around to help us and support us.
Exactly.
So then I decided after my son was a year old that I wanted to get into private practice and help be in moms' corners and support them and make motherhood easier. So I started the Mama Coach here in Halton, but I service moms all over Ontario and Canada. And I've also helped moms in the United States with sleep, breastfeeding, bottle feeding, pumping, prenatal classes. So they're all virtual now, but prenatal classes, prenatal breastfeeding classes, you name it. And I kind of do it all because it's all in motherhood. And really, to be able to support moms, you kind of have to meet them at every stage.
Yeah, and being able to know that they have a go-to person for these areas. That is, yes, because it can just happen in an instant that it's not working. What was working for so many days, weeks, months, all of a sudden out the window. What's happening? Do I have to start from scratch, or is there something else I can do? Yes, call somebody like Sandra for a consultation, because it makes the difference between having to be forced down one way that you think is your only option, and then being able to be really exposed to all of your potential options. And it really takes a professional to come in and assess what's happening and be able to give you a personalized approach to what you can take on based on what's happening with you and your baby. And
and it's so true. I walk alongside moms and families. I'm here to meet their goals and their wishes, whatever those are, because they're not mine. If your goal is to breastfeed for 6 months and then bottle feed or exclusively breastfeed, then that's where I'm going to meet you. I'm non-judgmental in any way. As I've explained, I've breast and bottle fed. And everyone needs support. It's not really fed is best, it's support is best, no matter which way you choose. And sometimes it doesn't go the way we had planned, and we need to know that that's okay, and find a way that makes us happy, makes our babies happy, makes our families happy, and works for us. Because at the end of the day, it doesn't matter what anyone else thinks. If you're happy and baby's happy and you're both healthy and growing, that's the most important thing.
Beautiful. So I'm gonna dive into your role. So I'm also gonna take this time to Let everyone know if you don't already know. Sandra is actually our lactation expert ambassador go-to in the Healing Mama panel of healthcare and wellness experts. So if you go to healingmamaco.com or healingmamaco.ca and you go to meet our experts, you will see Sandra there. And if you have any questions about lactation or breastfeeding, send us a message and we will forward that over to Sandra, or you can contact her directly. So you will get Sandra's amazing original write-up about all of her practical and thorough how-tos that's included in the Healing Mama Guide that comes with every single one of our labor and postpartum systems. So you are armed with Sandra in literally your back pocket. Actually, I'm not sure if the guide will fit in your back pocket, but it will fit in your pants. I mean, it's quite small. We made it compact, so it's easy to carry around.
On your nightside table, your diaper bag.
On your nightside table. At the hospital, as baby's coming out, you've got Sandra with you and all of the
I'm right there.
Yeah. So I want to talk about a few areas of breastfeeding that has come up a lot in many of our discussions. So I want to talk first about antenatal breastfeeding. Am I saying that correct? You tell me.
Hand expression? Antenatal hand expression?
Antenatal hand expression.
Yes.
Please clarify what that is and tell us, are there cons to it and what are the benefits?
Yes, so absolutely. Antenatal hand expression, I mean, hand expression, we all know what hand expression is if you breastfed your baby, right? Yeah.
Yes.
You know, got my fake boob. It's expressing milk
with
our hands. Yeah, don't worry, I'll grab that out. Hand expression is expressing our own breast milk with our hands. And so antenatal hand expression, antenatal means in pregnancy. So it just means hand expressing our colostrum in pregnancy. And it is not new, but it is new in the sense that we are really now only really starting to utilize it. It was used here and there and people, you know, did know about it, but it wasn't a well-known thing. And so, you know, there are so many benefits to antenatal hand expression. It is huge, whether it's your first baby, your second baby, your fifth baby, it doesn't matter. I do antenatal hand expressions. I have a course and I do consults on it. And I suggest that, you know, majority of moms do it. So you can start antenatal hand expression at 37 weeks of pregnancy. You do need to get your healthcare provider's permission because there are some contraindications or some reasons why you shouldn't do it. And those, for example, would be if your placenta is low-lying or you've had bleeding, if you, if there's any concerns with baby or your uterus, if you have a cerclosion, whether that's cervical or abdominal, those sorts of things. So you do need to get clearance from whether it's your family doctor delivering you, your midwife, or your obstetrician, just to say, hey, can I do this and is it okay? And then once you've gotten the okay, then once a day you're going to express with your hands for 5 minutes and you're going to collect that colostrum. And by collecting that colostrum into little syringes, you are building a freezer stash for your baby before your baby even comes. And the majority of women will get colostrum out because remember, colostrum is our first milk.
It's liquid gold.
That liquid gold, yeah. We start producing it around 20 weeks of pregnancy. Some women will leak and other women will not. And that's totally fine. Whether you do or you don't, it doesn't mean you're going to have success at breastfeeding or you're not. You know, don't worry about that. We worry about everything as moms. But we start producing it and we do start expressing it or it leaks out. Most women will notice that they start leaking their colostrum. Yeah. So we're basically taking that little bit of colostrum that's there and collecting it, putting it in the freezer for when our babies are born. And the nice part is, especially with COVID, is that you can bring that stash of breast milk to the hospital with you. And instead of giving your baby formula, when we all generally don't want to, if your goal is to breastfeed, we're able to give them that expressed colostrum that we've had. So we don't need to jump right to formula, which is just amazing. And it's the best thing for our baby at that time. So you just bring it with you, and when your baby needs it, you have it there. And some common reasons why we might give formula supplementation are if you have gestational diabetes or type 1 or type 2 diabetes, because baby comes out with low blood sugars. If you, maybe in your previous pregnancy, you struggled with breastfeeding, you had a low milk supply, then that would be it. If you have any complications with pregnancy, that can delay our milk supply coming in a little bit. We still have colostrum, and every day we have more and more. Just takes a little bit longer for our transition and mature milk to come in. So you would use that in between. If baby's not latching on well and we need to give baby some form of supplementation, then you would use your colostrum. If they're jaundiced, if they're losing weight. I mean, the reasons are endless. And if you're exhausted or sick too, right? Sometimes we unexpectedly get sick and we're not able to directly breastfeed. And so this would be an option for your partner or your family member to give your baby. So, I could go on about the benefits of colostrum, but we all know what they are. And so to be able to collect it at the end of your pregnancy and store it and bring it in for the times that you need it is just amazing.
Okay, so just as a recap, check with your healthcare provider, whoever you are seeking prenatally, if antenatal hand expression is okay for you to perform 37 weeks onward. You can start doing the antenatal hand expression. Now, in terms of the collection, the syringe, is that a syringe you can find anywhere, or is there a specific type that you should be using to collect the colostrum that you are expressing?
Yeah, you can get it, off of Amazon, maybe perhaps your local drugstore. I do have a little kit that I send moms that has all the different sizes of colostrum, the medicine cups and all of that, all their supplies in one that they get from me to collect it. I was told recently that Haka now actually has antenatal hand expression little tubes that you can use as well. So there's lots of different options to collect it. You do want to make sure that it is clean and that you're dating it and labeling it and putting it in the freezer. But there's lots of different vehicles to collect it in. But I do send it's a little freezer bag full of all the supplies that moms need for the collection.
Amazing. So guess what, ladies and gentlemen? Healing Mama Co. is going to now work with Sandra. She doesn't know it's right now. Surprise! We're going to be adding these devices into our shop at some point, and we're going to work with Sandra so that we can also provide that as a resource for our postpartum mamas, because this is where Healing Mama Co. lives and exists, is through the childbirth and postpartum phase. So we talked about antenatal hand expression. Let's talk about that first latch when baby might still be gooey and icky, just straight out of the vag or straight out of the, let's talk about a vaginal birth.
Of the belly.
Talk about belly birth after. So first let's address a vaginal birth and how soon a baby is latched to mom, because that might be a surprise for first time mom. It's a surprise for me. It might be a surprise to first time moms, like, oh, I'm gonna latch right now. I'm gonna try to get my baby on the boob right now. Can we talk about that first latch and what that can be like, and then talk about a belly birth after?
Yeah, so we ideally, whether you've had a vaginal birth or a C-section, we ideally try and get baby latched onto that breast in the first hour, as long as you and baby are okay. Always want to make sure that both you and baby are stable and okay. And then we get baby right onto the breast. I mean, if you have a vaginal birth, baby comes right up, skin to skin, naked, gooey, beautiful on your breast or on your chest right away, and your chest is really close to your breast, and if we leave baby there, baby will naturally start to crawl over. It will smell all of our nice scents and hormones, and our areola And our colostrum smell very similar to amniotic fluid, which they've just come out of. So it's a very familiar environment to them. So they will naturally start to gravitate to our breast if we do nothing at all. But we
They'll
do
just
try and
start
encourage,
crawling up,
yeah, they just
finding
start
it.
moving, they do their little crawling over there. But naturally, your nurse, your midwife is going to really help get that baby over there within that first hour and get them latched. And that latching might look like the perfect, beautiful latch that you've seen with a big, wide open mouth. It may be a couple of licks and sucks, and that is okay too. We're happy with any contact that baby has with the nipple and the breast to start all those hormones to produce more and more colostrum, to produce that transitional milk, to produce our mature milk. So really anything that we can get on the breast in terms of stimulation in that first hour is best. And sometimes if it doesn't go very well, because remember, you're learning and baby is learning. Neither one of you, especially if it's your first time having a baby, knows what to do. And there's a learning curve to breastfeeding.
It is the steepest curve in life.
It is. And it's stressful, and it's like, as I said, it's on the job, right? Like you don't get weeks of training. I mean, you can, and I absolutely advocate for women to take prenatal breastfeeding classes so that you're more educated on what to expect and to make that go even smoother. But it really is learn as you go and learn as you grow. And so, even if it doesn't go as beautifully as we had hoped, we want to keep baby skin to skin as much as possible. Exactly. Skin to skin is a magic reset. It has so many beautiful properties to it for us as moms, but also for our babies. It regulates their heart rate, their temperature, their respiration. It calms them down. It calms us down. It helps to get all those hormones going so that our uterus contracts and our vaginal bleeding, becomes normal, or we don't have a huge hemorrhage. It helps produce the milk, right? That colostrum. So there's so many benefits to it, but it's also one of these things where if you're feeling frustrated, breastfeeding isn't going well, put your baby skin to skin. Remember, it's that reset. Put baby over your heart on your left side. Just do lots and lots of skin to skin.
Great tip.
We know that babies will show signs of being hungry sooner when they're on our chest than they would when they're bundled up in a cot or a bassinet beside the bed.
Got it.
We also recognize those signals that our baby's giving us a lot sooner as well. And so the more time you can spend skin to skin in those first couple of days, the more beneficial it is for baby, the more baby is feeding what we call on demand. Now, I totally recognize that labor is a marathon, and we are absolutely exhausted from birth, and everybody's birth looks a little bit different. And so if you're not able to do skin to skin, have your support person do skin to skin. Whoever your partner is can take off their shirt and do skin to skin as well. And it will have the same benefits for baby. Obviously, baby can't latch on and feed, but your partner is going to start to recognize those feeding signals sooner, pass babe off to you. Exactly. So then you get a bit of a rest as well. But really having all those benefits for you, baby, and for your partner when you're doing skin to skin.
Exactly. Amazing. Okay. And so let's talk about a cesarean birth and when a mom can actually start latching and breastfeeding after giving birth through the belly. Cesarean birth, aka belly birth.
That's right, a belly birth. So, I mean, really, probably, again, ideally would be within that hour. It might be hour and a half or 2 hours, depending on how soon you get into the recovery room. Some hospitals are very forward thinking and forward moving, and that they might actually be able to get baby skin to skin right in the operating room. You're not going to be able to breastfeed because your breasts are covered by the drape, but you're going to be pretty close. And so a lot of hospitals do skin to skin as soon as possible. And if they're not able to do it with mom, then they'll get dad to lift up his shirt and do it.
Okay.
So that skin to skin again happens right away. And then as soon as you're in the recovery room, then we would get you latched and get baby feeding right away.
Wow. Okay. Perfect. And We just had a comment. Hello, always
Oh,
love
I
these
see.
opportunities to talk about breastfeeding. Congratulations on the
Yay,
labor and the breastfeeding
congratulations.
journey. Congratulations. So I want to also now talk about common things that happen for women that will discourage breastfeeding. So let's talk about engorgement. Let's talk about mastitis. And, what are the first signs? What can we do right away? Once it escalates, what can we do right away? And talk about that part of it.
So let's start with engorgement. So engorgement is a natural thing that happens to every single mom when we have a baby. So typically about day 3 after a vaginal delivery, our milk will come in. We have colostrum, and every day we have more and more colostrum. So I don't want anyone to think that they do not have milk. You do have milk, you have that colostrum, but your transitional milk will come in roughly day 3. Again, there's things that will impact it, and a cesarean birth will push that a little bit later. But typically on day 3, after your baby has cluster fed, right? Babies cluster feed. They're on the breast, feeding nonstop at around 48 hours. And then the next day, your breasts are what we call engorged. Your milk is come in. They're also swollen with fluid that you've had during labor and delivery. But they're feeling really tight, firm, and uncomfortable and sore. And so, the simple thing to do is to get your baby on the breast, feed to alleviate that engorgement. The more babies on the breast and able to empty that out, the more it's going to feel better. Yes, empty.
Liquidate.
Yes. When our breasts are empty, our body knows to make more milk. So if we're not emptying the milk out properly, then it's going to think that we don't need any more. So get your baby, and that applies anytime throughout breastfeeding. So get your baby on the breast. But it's really important for all moms to know that engorgement does happen to everybody.
Yes.
It doesn't mean that there's anything wrong, but it's really important to recognize that, oh, hey, it's there. What am I going to do about it? I'm going to get baby to the breast and feed lots. You can put warm compresses on before you feed. Do lots of breast massage while you're feeding. If you feel any full milk ducts, and I tell all my moms they feel like grapes. So if you know what grapes feel like, they're in your breast whenever you have a full duct. You just feel where those grapes are, and you just gently massage them out while you're feeding. That's going to release the milk and give baby a bit of a surge of milk. After you're done feeding, if you're still feeling a little bit uncomfortable, you can hand express, right? Hands free, don't have to worry about a pump, exactly like antenatal hand expression, but we're expressing after, just for a couple of minutes to ease any milk that's in there and just make it feel better. So hand express, and then you can use cold. So there's, lots of nice little rings that are cool that you can put around your breast. You can use ice, a bag of peas, anything cool after you breastfeed, warm before you breastfeed. If you're feeling uncomfortable, jump into a shower, let the warm water go on your breasts. It will let a little bit of milk leak out. All that sort of stuff. You can take Tylenol and ibuprofen if that is okay with you, and you don't have any allergies or contraindications, and you can take it as directed on the back of the container for discomfort, because it is uncomfortable.
Right.
It's very uncomfortable. So doing that and just giving yourself grace. And it does even out over time, right, but it is important to make sure that we are emptying it out and then, relieving some of those symptoms.
Yes, we provide the Lancino 3-in-1 breast therapy pearl pads in our cesarean and our ultimate labor and postpartum system, because you can use it in the cold therapy and also warm it up and use it as hot therapy. It was definitely a go-to while I was breastfeeding to handle the engorgement, and using the cold therapy to just get that relief from it just felt like my breast was pulsating.
Yeah.
It is.
They have their own blood flow.
Exactly. Something is happening down there and it needs to stop because it's.
Yes.
And then, we'll talk about hot therapy to help produce lactation, but let's transition. And how does that transition go from engorgement to mastitis, and what does that look like?
Yeah. So, sort of engorgement, as I said, if we're not emptying our breasts out, then we get plugged ducts or blocked ducts. It's the same thing. Our milk ducts, those little vessels in our breasts that are holding milk, we're not emptying them out, so milk is staying in. They get really hard, they get swollen, they get painful, and they get red. They feel like hard grapes. We're not able to express them out. That continues. And then because there's no milk movement, we can develop an infection within our milk ducts. And when we have an infection, that's really when it turns into mastitis. And so signs of mastitis are a temperature of over 38, fever, chills, flu-like symptoms, red, hard area, painful area on your breast. It will be in that specific area.
Right.
But really most of those symptoms, except for the flu-like symptoms and the fever, are similar when you have a plugged duct. So when you start having chills, fever-like symptoms, and a temperature greater than 38, 38.5, then you have mastitis. And you can, as soon as you start to feel it coming on, you can start to use the techniques that we talked about to release that milk and get it out on its own without the infection really coming on full strength.
Right.
You can usually do that within 24 hours, but really at the point of signs of infection and a temperature, then you need to reach out to your healthcare provider to get put on antibiotics. If we don't get on antibiotics, then it can turn into more serious things down the road. But antibiotics that they give you are safe to continue to breastfeed with.
Okay, perfect. And can you just let everyone know, even if you're sick as mama, you can still breastfeed? It's totally.
Absolutely. So, there's actually very few contraindications to breastfeeding in terms of when you're sick or, all that kind of thing. And if you're ever unsure, if you're having medication or going through a test or something like that, and you're not sure whether you can keep breastfeeding, reach out to myself or a lactation consultant, and we can review that with you, because you'll probably be very surprised. But remember that our milk is being developed on the spot, right? It's changing every day for our baby's needs. And what we are experiencing, our body is developing antibodies against, and we're passing those antibodies through our breast milk onto our babies. And so that's why most moms, when they look back and go, oh, I had a really bad sinus infection or cold or something, and surprisingly my baby didn't get it, or they had very much more milder signs of it. And that's because we passed that active immunity on to our baby, because as our body was fighting it, we were producing the antibodies to protect our babies. Same with on our skin, we pass a lot of antibodies and immunity onto our babies, just having them skin to skin. And so yes, we still want you to breastfeed, because the benefits of breastfeeding for both mom and baby are huge. Now, there is sometimes when we just feel like crap, and we are physically not able to breastfeed. And so that would be when you would want your support person, your partner, to step in and feed your baby for you. You can pump, you can hand express, still have the stimulation not impacting your milk supply, and still giving baby all the benefits, all those antibodies. But sometimes we do need to recognize that, I need to rest and I need to recuperate to feel better. And so sometimes we need to ask our support person to step in and help, but we can still provide them with breast milk. And, we know with COVID that this is especially important. So if you have COVID-19, whether it is, a positive test or you suspect it, then you need to make sure that you continue to breastfeed, but that you maintain those hand hygiene. So you wash your hands, you wear a mask, and then you also change your clothes so that there's no droplets on your clothes while you're breastfeeding. So when you're about to breastfeed, change your clothes, because all those droplets are on our clothes if we sneezed or coughed on them. Wash your hands, wear a mask so that we don't spread COVID-19 onto our babies while we still continue to breastfeed.
Okay, fantastic. That is great information for what's happening right now, and ways that you can still be able to breastfeed. Knock on wood, should you be diagnosed with COVID-19 and get a positive test.
Yeah.
So,
yeah,
yes.
and if you're not, reach out. There's lots of things that we can do in the meantime to maintain your milk supply. until you're feeling better. But it's nothing that you need to stop breastfeeding if your goal is to continue to breastfeed.
Got it. Can you talk about ways that partners can support breastfeeding and maybe a top tip that partners can do?
Yes. So absolutely. Our partners are really, when you're a new mom, I don't think there's any words to describe the
There's
importance of our partners.
it's
I can't find a word. I can't find a word. They really can make it or break it. I will say they can make it or break it. And so, I think taking a prenatal education class with your partner before your baby arrives is super important so that you both know what to expect. You both have an understanding of what's going on, so that your partner can be supportive and be that cheerleader for you when you're getting discouraged. They can say, hey, no, wait. Like, remember, look at all the amazing things you're doing. We've got this. We're good. Or, you know what? I think we need some help. Let's reach out. So being that support person, having an understanding of what is going on, what's happening, so you can really be that pillar of strength to mom, to, the new parent. And having each other to really support each other. In the night, the partner can bring baby to mama. So they can change the diaper, they can get baby undressed and bring baby to mama. So mama really just has to breastfeed, and then even the partner can take the baby off when it's done and wrap the baby back up, swaddle them and put them back to sleep, so that all that supportive things. Bring food and drinks to mama, because we are so thirsty. I think that was one of the biggest things I was super surprised about, was as soon as my baby latched, I felt like I was in the desert. Give me water, right? I needed water. And so bringing water or some form of nice liquid, whether that's, a non-caffeinated tea or something like that, to mom, so that she has it right there beside her. Bringing her snacks and treats so that she can munch on healthy, good snacks while she's feeding, to continue to give her the calories that she needs to build the strong milk. Just being there for her, cheering her on when she might be getting discouraged, taking her to appointments, and being there for her are probably my biggest tips. And also just knowing that you don't always have to say something. Silence is okay. Sometimes just sitting there and being supportive is more than words at that point. And, just saying, please let me know how I can help you. I want to help you. Please let me know. And know that your partner is asking that out of general concern. They're not asking you. Sometimes we get a little bit snippy in our frustration and our sleep deprivation, but don't be afraid to say, you know what, I really need you to give me 5 minutes by myself,
Right.
Or can you go grab me water or drink, whatever that may be.
Exactly. My husband's best friend had his baby his first baby 6 months before us. So it was good for him to get kind of a heads up about his role. And the best piece of knowledge that he shared with my husband was, if you think Rowena's eating a lot now before baby comes out, just wait until she starts breastfeeding. And fortunately, my husband kept remembering that. And so I would ask, he would bring me food, and then I would still want more food. It just felt like I was an endless pit that could not find fullness. I just couldn't find it. It's just everything kept coming in, and then nothing. It felt like nothing was sticking. And he's like, he basically was able to figure out that he would create food for me and himself, and then always have extra for me, knowing that it's most likely going to be eaten by me after.
That's right.
Exactly.
That's right.
So first time mamas out there, just be prepared. Breastfeeding and your food and nutrition is so key to your success and being able to physically handle the demand of breastfeeding and dealing with that feeling of feeling like a cow, because yes, you are feeding on demand, and the demand is not yours. It's the little human that you just brought earthbound, and it's
Yes.
It's having your partner understand and be totally comfortable with you eating 2, 3, 4 times more than they eat. Yes,
Yeah.
I was up to almost 5 times more than what my husband ate. It was
Yes.
crazy. I could not. I enjoyed being able to eat as much as I did while breastfeeding, but it's something that I also wasn't fully aware of what that feeling would be like, what that experience would be like until I was deeply breastfeeding.
Yeah. And I talk to so many parents about building a postpartum plan. So we've all heard about, labor
Yeah.
plans, our birth plan, and all those sorts of things. But we forget about our postpartum plan. And I actually think that your postpartum plan is way more important than your birth plan. You should have both. They're great to have. But labor is a short period of time. Motherhood and postpartum is a long period of time. And on that postpartum plan, it does include, building your freezer stash, having groceries all lined up, having an idea of what are your goals and your wishes for breastfeeding. Who do you reach out to for breastfeeding support? Who are your medical people that you're reaching out for, whether that's for your own health or for babies? You had Dr. Lydia Brody on there, so all those naturopath, chiropractors, pelvic floor physiotherapists, having them on there, knowing who your support people are. I mean, we can get into a postpartum plan more in depth, but just the two pieces that we talked about are super important.
Now that you say that, I'm just going to grab it. So we also provide a postpartum plan in the Healing Mama Guide, and I went to grab one because I have one right here. Of course, I wouldn't come and do a live without it, and it's called our Lying In Plan. So the guides that come with every single one of our labor and postpartum systems, which also has Sandra's original write-up, also comes with a postpartum plan, your lying in plan, who your go-tos are, goals and ideas to keep in mind what to prepare. It's all in your guide. So this handy thing that you can keep kind of in your hands, like it fits between your hands, you can have it right by your bedside, because planning for your 4th trimester is essential to your holistic recovery. And it can't happen if you're just gonna wing it and you're just gonna tell yourself that I'll just figure it out as I go, because there are moments where you can do that, where you fill in the blanks with that, but you need to have your foundation in place so that you have a fallback. Like if everything is hitting the fan and nothing is working, you have something to refer to and say, what did I write? What do I do now? Okay, yes.
And nobody likes to wing it for a long period of time. We're okay winging it for short periods of time, but nobody likes to wing it for long periods.
Yeah, it's like there's no more ideas. It's blank. I just need someone to tell me what to do. And so you also get a lying in plan. And we actually use the lying in plan that Earth Mama created, because it's actually really quite in depth. Amazing. And can we talk about any other blind spots that you notice happen often while moms are breastfeeding?
So I think, a big, so I think a big blind, not really a blind spot, but a common thing that comes up that sometimes we just sort of brush under the rug is pain while breastfeeding. Pain is not normal when we're breastfeeding. Of course, it is a new experience. It's new tugging and pulling. So we do have some discomfort that should go away quickly after baby latches. But if you are having pain, if it is uncomfortable, if you are swearing, you are banging your heel in the ground, do not put up with it. It is not okay. You need to seek help. So reach out for help. Even during COVID, I'm doing virtual lactation consultations, but I am doing some in-home ones for emergencies. So always case-by-case basis. But it is really important to reach out for help, because we cannot stand for pain. There are so many different things that can be causing that pain, and really it is a professional that can help you look and dig deeper into what is causing that pain and make it go away. Because if you're having pain, you are not enjoying it. It is not a beautiful experience, and I say this out of personal experience. I had a lot of pain when my daughter was latching because she had a tongue tie. and I drove my heel into the ground and swore every time she latched, and I did not want her on the breast. I wanted her on the breast only when she absolutely needed to be, not a second longer, not in between. And it really impacted our supply, and it can go further into impacting that relationship that you have with your baby, because it's not even a beautiful experience to want to have your baby latch to your breast. So if you are having any discomfort, any pain, whether you think it's mild or severe, never ignore it. Reach out for help.
Thank you for bringing this up, because too many women will just take it and have this assumption that it's a part of motherhood. No. All of these preconceived notions that it's okay, I'm going to take it, this is a part of it, all of that just needs to just be gone with.
Gone.
We need to eliminate it from the conversation. And yes, it's common, it is not normal. And that there are professionals like Sandra and anyone in your local area that can help give you the guidance so that it is not a painful experience anymore.
Yeah.
Ever again. And that if it does become, you will now be armed with the techniques of how to maneuver your baby and your body and your breast so that it no longer becomes a part of your journey. Thank you for bringing that up.
You're welcome.
Women that will just take it,
and I was one of them for 2 weeks.
There you go, exactly. Sandra, from her own experience, is now the one who is available to give the advice and guidance to support you through having a beautiful and pain-free breastfeeding journey. So I want to talk about your amazing giveaway that you've provided for Parent Shower Week. So can you talk about the benefits of the Silverette cups?
Yes, and I should have brought them. I don't have any, and I can't even run because they're in the opposite side of the house.
You know what?
I remembered my boo, but not them. There they are. So Silverette nursing cups are, they're these amazing magical cups that I call them magical cups, and a lot of moms do. They are real silver, and silver is an anti-inflammatory and antimicrobial and antifungal. I mean, we've used silver for many things in healthcare for wound healing for years and years and years. So this is using actual real silver in these little cups. They're all silver. They're not silver plated. You do not want silver plated ones. They're all silver. You put them on your breasts after you're breastfeeding, in between breastfeeding sessions, and they help heal your breast. So if maybe you did have pain, you have cracked, bleeding nipples, you have nipple damage, and you are working with a professional to get it fixed, but we're still have that nipple damage, these are great things to utilize. And just have, even if breastfeeding is going well, these are great things to just have and have on your nipples in between breastfeeding sessions when you need them to help protect and promote good health within our nipples. Okay. So they are available in the States. You can buy them on Amazon. Here in Canada, I do distribute them, so I do sell them. So moms can reach out to me if they would like to purchase them. And I am gifting them to one of the mamas here because I think they should be in every bag, in every diaper bag. If you know somebody who's having a baby, this is a great gift. If you yourself are having a baby, get yourself a pair. They are expensive, but you can use them through multiple kids, and so they are worth it, but they're awesome. And I'm so excited to be able to give one away to a mama to help protect her breasts and her nipples.
Thank you so much. And I want to ask, should a mom have, we've seen moms who've had yeast infections on their nipple and have had to take oh my goodness, basically had to take meds to get that corrected.
Yeah.
And when you have your, let's say, nipple balm, how long would you say the difference is from using it and getting relief and having your nipples, let's say, clear up versus not using it and hoping that a balm or something would do the job?
Sorry, my audio cut out. The school board was calling me. I'm not sure why, because my daughter is doing virtual learning. So, yeah, so if you have, a yeast infection, then you would obviously want to deal with the yeast infection by getting the antifungal. This doesn't replace it, but it is something that you can use afterwards, to help. Don't want to not have the medication that you need. This isn't going to fix that. It isn't going to make the yeast go away,
Yes.
because both you and your baby need to be treated for a yeast infection if you do indeed have one.
And let's say you had just cracked nipples or sore nipples. Uh, how long, how quickly does the Silverette cups work on?
Yeah, so it works pretty quick. I mean, every mom is different, but I think you're going to start to feel the difference, you right away, within a couple of times of wearing them. But then I've given them to moms that have had nipple damage, and 24 hours, 48 hours, 72 hours, they just keep seeing how well their breasts are healing. And so
Wow,
the more that they're on, the more that they're healing.
got it. Okay, so one lucky winner is going to win a Silverette nursing cup. So follow the separate post and how to enter that we have posted or will be posting right after this talk. So I'm just going to put you on the spot really quickly and ask you, do you have a favorite or a top go-to that Healing Mama Co. offers or provides in our Healing Mama home?
What is my favorite product?
Yes, product
Oh
or bundle
goodness.
or
I love them all. So I think that they're all essential, but I would probably say, we talked about it earlier, the silicone, the Lancinol silicone rings for breast engorgement. I think that those are just phenomenal. And they should be a must for every mom, as well as a good nipple cream. And you have the Matter Company's nipple cream, which is awesome. So
yeah.
those are
We
probably
actually have
my two go-to.
five brands of nipple.
Vibrant, yeah.
Five
See,
brands.
you've got them
Choose
all.
what you want. Whatever you want. We are the new quote unquote Amazon, but Healing Mama Co. for childbirth and postpartum. All the brands that you want, we're getting them if we don't have them yet. So, Sandra, thank you so much for your time.
Thank
Can you
you.
tell everybody what are the ways that they can contact you and communicate with you?
So you can easily on here reach me at my IG is Sandra the Mama Coach. You can get me on Facebook. You can email me. My email is sandra@themamacoach.ca. And you can, probably the easiest way is always through here on IG. You can send me a DM or you can reach out. And then also my website, which is sandra.themamacoach.ca. So lots of ways to reach out to me. And if you forget or you're unsure, Rowena, I'm sure, is happy to pass along my information.
100%. So if none of that comes to mind and you want to get a hold of Sandra, you can always contact us. You can head to our Healing Mama home, meet our experts. Sandra is there, and we will pass along any questions and concerns on your behalf.
Thank you.
So,
thank you so much.
Thank you for joining Parent Shower Week. We 100% appreciate it. And have an amazing rest of your Tuesday, Sandra.
Thank you. You too. Take care.
Bye.
Bye.